Thank you, Cathaoirleach. And thank you, as always, Minister, for your response to the Seanad. Is really your great commitment to us. I really appreciate it. So, Minister, I really welcome the announcement in the budget that there was an additional £6 million in funding for your department. I have asked for this commencement on the basis that we really need to understand how much of that is being apportioned to the drugs and alcohol task forces for the actual drug strategy. You're no doubt aware of the views of the chairs of the drugs and alcohol task forces around Dublin, of which I am a member and privileged to be the chair of the Dublin 12 Drugs Task Force, Drug and Alcohol Task Force. So to use their words, and for much of this I will use their words, the drugs initiative budget has been cut every year between 2008 and 2014, resulting in an overall cut of 35% to key services responding to the drug problem on the ground. There has been little or no attempt to restore these recession-era budgets, and no increase in the allocation between 2014 through to 2018, and even in 2019, when there was an additional 20,000 per drugs task force, half of that was clawed back in 2020. And again in 2021, there is that need and anticipation of a need for an increase in drugs and alcohol task force budgets. There has been a failure year on year, and it's very frustrating and demoralising for those working on the ground. The drugs problem has become more and more widespread, it's complex, it's deep-rooted. Each individual community has its own particular problems to deal with and to be met, so they need that discretion even to model their actions on a local level and respond on a local level. We have a commitment in the programme for government. Our programme for government states that the drug and alcohol task forces play a key role in implementing the strategy and increasing access at local level to harm reduction initiatives. We will examine how we can continue to support it in identifying local need in communities and support targeted initiatives addressing drug and alcohol misuse. So to date, there isn't a huge progress in amplifying and supporting the increase in the demand and the need for those services, though I do acknowledge your absolute commitment and support, and acknowledge you meeting recently with representatives of each of the drugs task forces and setting out the 6 strategic areas that you're going to work with the task forces on. But the things that were highlighted in the budget submission from the drugs and alcohol task forces is that inflation is going up, yet the budget hasn't matched that. There is this increased demand, this tsunami that's expected post-COVID. We need an increase. There's an increase in the number of people with dual diagnoses that we need to be able to respond to. There is no discretion for design and delivery in the scope of the funding that's available to services. We need to build back better. That the pandemic response needs to be phased, targeted, really community focused and community based. Because of that, the culture and context is very much unique to each individual task force, and even I see within our own task force in the individual areas within Dublin 12. So I would really welcome your comments on how much of this budget. It would be great to see a huge amount of it because it is more than needed, to say the very least. So thank you, Mr.
Again, I want to thank Senator Carey for raising this issue, and I welcome the opportunity to update the House on the funding budget allocated in Budget 23-22. And I just want to echo your response regarding the work that the task forces do. I have huge admiration and thanks for the great work that the volunteers and indeed the people in the task forces, the work they've done. So I want to put that on the record. I am providing £6 million in new funding for new measures to support the implementation of the National Drug Strategy, and this funding will strengthen the health-led approach to drugs and alcohol use and will deliver on new strategic priorities for 2021 to 2025 under the National Drug Strategy, including commitments in the programme for government which you have stated. I am happy to inform the Seanad that I am providing €0.5 million to increase access to and provision of community-based drug and alcohol services in Budget 2020. And the funding will have a specific focus on service for women, ethnic majorities and LGBTI+. It will address the barriers that women and minority groups can face in accessing drug and alcohol services. The lived experience of people who use drugs will be central to the design and delivery of the new services. The new services will be developed in conjunction with the National Network of Drug and Alcohol Task Forces. And the Department of Health has published a fact sheet on the allocation of the 6 million funding, and the fact sheet is available online and is being circulated to all stakeholders, including to drug and alcohol task forces and community and voluntary sector. Senator, you will be interested in the other measures I'm supporting in Budget 2022, and these include 1.7 million to increase the availability of HSE drug and alcohol services on a nationwide basis for people with alcohol addiction, people under 18, families affected by drugs and rehabilitation. And there's 0.7 million to reduce the impact of parental drug and alcohol use on children and young people, in line with the joint HSE-TUSLA Hidden Harm Strategic Statement and Practice Guide. 0.3 million for harm reduction responses to address high-risk drug use such as crack cocaine and stimulant drugs in local communities and the nighttime economy, and to extend an naloxone demonstration project to prevent drug overdose deaths. Also 0.7 million to provide health screening and brief intervention for people who use drugs, known as SAOR. This service will be a core component of the health diversion programme for people found in possession of drugs for personal use, so that they are treated with compassion and have the opportunity to avoid a criminal conviction. And also 1.3 million to expand health supports for people who are homeless and have complex health and addiction needs. This includes an additional 260 tenancy under Housing First and an enhanced health service for up to 4,000 single homeless people in Dublin. I do envisage a key role for community and voluntary organisations, including the network of drug and alcohol task forces, in delivering these new measures, as I've announced in Budget 2022, and additional resources will be directed towards interventions that lead to reduction in problem drug and alcohol use and achieve an improvement in public health outcomes. And measuring the effectiveness of these additional services will therefore be an important objective of public policy. And I just wanted to thank you, and I believe that dual diagnosis, which you've raised, it is an issue, and it's an issue that we need to work on across all sectors of departments, and it's an issue that I will be very keen to work with you and all the stakeholders in ensuring that we can tackle a bit more robustly than has been over the last number of years.
Thank you very much, Minister. And I do really acknowledge your own personal commitment from the moment that you took on this brief, that you have shown an extraordinary commitment and openness to listening to the sector as well. I really welcome the breakdown, and we'll be delighted to share that with the chairs of the Drugs Task Force and the coordinators when I go back to my office today. I think that one thing I would say is that the health model is a little bit problematic when you're dealing with such a complex basket of needs here, and such it requires perhaps interdepartmental and certainly interagency responses, and I think that in the strategic review I would hope that we will get an opportunity to really highlight that with you, just how we need discretion. There needs to be some sort of a discretionary element to the budget in its provision. Thank you.
Thank you, Senator. Minister.
Also, I think following agreement on the strategic priorities for the National Drug Strategy for the period 2021-2025, I recently met with, as you said, the Drug and Alcohol Task Forces to outline additional funding I am providing to deliver on strategic priorities. And again, this includes 1 million funding programme for development of community-based drug and alcohol services. The programme will adopt a population-based approach to the provision of drug and alcohol services in line with the Sláinte Care model, and an allocation will be provided to each community healthcare organisation and will engage with drug and alcohol task forces to identify service priorities for the region. I think that's been very much welcomed by the task forces. I will also be announcing shortly a prevention and education programme on drugs and alcohol use amongst children and young people, and there will be an opportunity for task forces to develop proposals for funding under this programme. And together with the measures announced in Budget 2022, I believe this additional funding will strengthen the health-led approach to drugs and alcohol use and deliver on the strategic priorities for 2021 to 2025 under the National Drug Strategy and the commitments, as you said, in the programme of government. Thank you.
Thank you, Minister.